Let's discuss gestational diabetes, also called gestational diabetes mellitus or GDM, which can pose significant risk to both the mother and baby if blood glucose levels are not well controlled. Here are the key concepts that you should know about diabetes. It is a form of diabetes that develops during pregnancy due to insulin resistance caused by hormonal changes. Gestational diabetes typically resolves after birth, but it increases the mother's risk of developing type 2 diabetes later in life or keeping the diabetes after pregnancy. Mothers with poorly controlled gestational diabetes are at a higher risk for preeclampsia and other pregnancy complications. A key diagnostic feature of gestational diabetes is if a mother is not diabetic before pregnancy, but develops diabetes or changes in blood sugar levels, specifically hyperglycemia or high blood sugar levels, only after becoming pregnant. As mentioned before, the diabetes will usually resolve or go away after the baby is born. However, in some cases, the mother will remain diabetic for the remainder of their life. Here, want to watch the full video? Watch the full video and get so much more with your full access membership by going to howtonremt.com or scanning the on-screen QR code now.